So hello, everybody. We're going to be having a discussion and giving you some tips about self-advocacy and healthcare for people with disabilities. I'm Dot Neri. I work at the Kansas Disability and Health Program. I have a disability. I use a wheelchair, so I've got a lot of experience with the healthcare system. And with me, I have Colin Olenek. Colin is an advocate with Self-Advocate Coalition of Kansas. I got that right, Colin?
Yes.
Okay. And also Kim Bruns, who is the program coordinator for the Kansas Disability and Health Program. And again, we want to give you some tips and some ideas. We're going to show a brief video, but then we also want to have a little discussion. So we've got Tyler Griswold with us, and we're going to talk about some of the ideas we present. So next slide. Kim?
Yeah, so I'll just briefly tell you the Kansas Disability Health Program is a CDC program that we have at the University of Kansas, and we work to support people with disabilities by helping people learn how to get more exercise, keep their teeth strong, eat good foods, and get the health care they needed. And for each of these, we have different programs and interventions that we support. And we help people with mobility disabilities, and we help people with intellectual and developmental disabilities. So we're all inclusive of people with disabilities and try to make life better. And our motto is, Kansans with disabilities can be healthy.
And it's probably, we didn't put this in the slide, but it's important to remember that we have a consumer advisory board that's made up of people with both mobility disabilities and intellectual developmental disabilities. So they advise us and review things that we're doing to make sure that we're doing things in the best way possible to help people be as healthy as they can be. So that's where we're at. Next. So now we're going to show you a brief video. It features a lot of self-advocates talking about why they want to be self-advocates and taking care of their health care and some ideas on how to do that, but mostly the importance of, when you can, learning advocacy skills and being an advocate in healthcare situations. So can you play that video, Jesse? And we want the first one there.
Welcome to the Taking Charge of My Healthcare Toolkit. This toolkit was created for people like you. It provides you with the knowledge and skills you need to advocate for the best care that you deserve. Remember, you are your own best advocate and you deserve the best care available.
Hi, my name is Eric. I am taking charge of my healthcare by learning more about my health and making sure I understand my healthcare rights.
The Taking Charge of My Healthcare Toolkit has important information, resources, and tips on how to work with your doctor, take your medication, prepare for a surgery, stay healthy, and more. In addition to viewing the videos, you can also view and print the modules that are available online. You may want to take some notes. Throughout the toolkit, you will hear how important it is to be your own best advocate. Self-advocacy means knowing your rights so you have information to make decisions and get the things you need. Self-advocacy helps you achieve your goals and be as independent as possible. Places where you can be a self-advocate include hospitals, the doctor's office, medical facilities. It's sometimes difficult to remember to be your own advocate, but it is important. Some examples of when you should be a self-advocate include when you want someone to listen to you, when you want to share your story, when you want to make a change in your life, when decisions about your life are being made, when choosing a support person. If you're wondering why you should be a self-advocate, it's so you can educate yourself and others of your wants, needs, and rights, Vote and help change policies and laws. Be involved in your community. Make choices about your finances, transportation, housing, employment, and education. Remember, you should always be your own advocate, no matter where you are. There are certain rules your providers must follow to keep your information private and provide you with the best care they can give you. As a patient, you also need to follow certain rules and follow the instructions from your healthcare providers. Understanding the instructions and rules will help you be your own best advocate and make the best choices for your health. Who can be a self-advocate?
I can. You can. We all can.
Me.
I'm working as an advocate and I'm fitting in with the rest of my peers in the community.
One day we won't have parents to take us to the doctors or do things for us. We have to stand up for our rights so we know we live in the community.
I benefit the most when I stand up for myself because only I know my body the best.
I feel strong when I stand up for myself.
I benefit the most when I stand up for myself.
When you stand up for yourself, you stand up for everybody.
I feel like everyone has the right to stand up for themselves because if we're not our own advocates, who's going to advocate for us?
You need to fight for your independence. You are your own person, and you need to do everything in your power to do it.
I feel proud. When I stand up for myself, it will give me the opportunity to be part of everything that's going on around me.
I took the time to understand what it means to be a self-advocate. I know that it is important to speak up and ask questions about anything that affects my life and my health. Always be your own best advocate. You deserve the best care available.
Great. Thank you. So we learned from the video that there's a lot of reasons to be a self-advocate and why some ways to do that. I think what we didn't learn from that is that self-advocacy for people with disabilities is relatively new. For a long time, people with disabilities weren't listened to, and it wasn't promoted to be a self-advocate. So healthcare providers haven't been trained to treat people with disabilities equally. So it's really important for all of us, as often as we can, to be self-advocates, to speak up for ourselves, because in effect, we're training our healthcare providers to work with us. And that's really, really important because they may not have been trained to listen to us. So as we do this, we're developing relationships with our doctors and our nurses and teaching them that we're full people and that we deserve to be listened to. So we're going to go through some tips and talk about them a little. And one of the first ones is to ask doctors and nurses to speak directly to you, not to a family member, a friend, or a staff person who is with you. People tend to see another person in charge, and they need to learn as doctors and nurses that the patient is the person they should talk to. And Colin has some experience with this. Colin, how have you done this in the past?
I have had I've had the experience of having doctors, particularly residents, when they enter the exam room, talking to the person who brought me about my care, I've had to stop them and correct them and have them talk to me directly. The staff is mostly there for support needs, not to direct my care necessarily.
So what might you say and how would you say it? Say I'm the doctor and I start talking to the staff person with you.
I'd say, hi, my name is Colin. I'm the patient, and you will talk to me about my care and about my needs and other things. My staff is just here to support me. Yes.
Good, that's direct, it's polite.
Yes.
Tyler, do you want to add anything to that? Have you had any experience like that?
No.
Okay. Okay, so again, asking the doctor or nurse to talk directly to you instead of someone else. The other person can be there and support you, but you're the main person when you're getting health care, so that's important. Can you go to the next slide? Another self-advocacy tip is to ask questions about your health, about a treatment the doctor might recommend, how to access the healthcare system, or anything that will help you to take care of yourself and be healthy. So for example, if the doctor says, I want you to go for physical therapy, well, what can I expect from the physical therapist? What is the purpose? Is it going to hurt? It might be about when is a good time to call your office if I have a question. So it could be about your health. It could be how to work with the system, with their office. It could be a lot of things. But it's really important for you to understand what you want to know about your health and how the doctor is going to treat you. Some people have questions about medications. Are there any side effects or any things that might not feel good about taking the medication? How long might that last? Sometimes you have to weigh the good it can do with not feeling good for a while. It might be if you've had an illness, how long will it take me to recover? When am I going to stop feeling better? When can I get back to my routine? If you're in Special Olympics and you say have a sprain, when can I get back to my activity? Those are really important questions, and sometimes doctors don't remember to give you all the details. So, and you know, another important question might be, how can I help this from happening again? And that's called prevention. That's called not just recovering from something, but trying to keep it from happening in the first place. So any questions you have for your doctor, it's really important to ask them. And sometimes you might write them down before you go to your appointment, because that can help you remember things too. Or your support person can help you remember them. But questions are really important. Do you have anything to add to that, Colin?
Well, I mean, just really, you covered it all. But basically, you know, how can I would myself would ask, how can I speed my recovery? Basically, I mean, what can I do? You know, what exercises would be good? One of the things when I had some leg surgery, I asked if swimming could help, and doctor said that was fine. So,
good.
Stuff like that.
Good example. Thanks.
Proactive, yeah.
Great. Okay, next slide. Ask the doctors and nurses to tell you things in words that you can understand, not medical terms. Sometimes a doctor will use the term cardiac infarction.
Yeah.
A lot of people, including me, didn't know what that was. It's a heart attack. Most people know what a heart attack means. It's pretty serious. So asking the doctor to use words that you can understand versus medical terms can help you to understand your health condition and take care of yourself. They might say that someone has a melanoma or Hodgkin's disease, lymphoma. That's cancer. Most people know what cancer it is. They might talk about therapeutic options. That means treatment. It means what you can do to get better. So using terms that you can understand instead of having to look them up in a dictionary or just not understand what the doctor's saying, can be really, really important to take care of yourself. And I think doctors and nurses don't always remember that they're using words that are not everyday language. So it's absolutely okay and important for you to ask questions when you don't understand something. And you might say, please tell me things in ways I can understand. And they'll probably back up and be happy to do that, because they want you to know, they want you to understand what they're saying so you can be healthy. That's what they're there for. So that's okay to do. Okay, next. Many people say that it can be really difficult to see a different provider when they go to the same medical office. A lot of us want to see the same doctor or nurse practitioner, whatever, because they know our health history. We don't have to explain everything, and we've been able to develop a relationship with them. So that can be really important. I was seeing a doctor at the Med Center who was a resident, and I didn't know when I started seeing him, but they change every year. So that means every year I'd have to train a new doctor in my health conditions and go over that again. So it's okay to ask, is there any way you can see the same doctor as often as possible? Now, anyone can get sick. Your doctor might be sick one day and somebody fills in, but most of the time, there should be a way for you to see the same doctor as often as possible. So that's an okay question to ask, and it shows that you want to take care of your health. Colin, anything to add there?
Well, again, if you can get your own doctor, that'll be not just changing every so often. I mean, that really is a key to keeping yourself just very healthy. And if you're in a situation where you have a different doctor every time you go, or something like where it's a dot situation, you know, just keep, I was just thinking about this, keep your diagnosis like in your papers that you take to the doctor, so you can show them, you know, and give it like, I've had this surgery, for this, and this. But, you know, you know, just try and keep it concise.
Good.
And to the point, basically, yeah.
Good. Thanks. Okay, next. And then I think it's really important to tell the doctors and nurses that you want to be healthy because you have a good life and you want to enjoy it. Often they don't know that we have things in life we want to do. We don't just sit around and watch TV all day. We get out and do things. And I think especially as Special Olympians, it's important for the doctor to know that you want to be healthy, you've got things you love to do, and that you have a good life. That's where they need to start with their commitment to making you healthy. And that's where that's an important thing for them to know. Yeah. Next. It's important to be a self-advocate, but everybody has days when they're stressed, or if it's a really important medical appointment, you may get some news that you'll have to think about and go over with people. It's good to have somebody there to help support you and remember things. And sometimes they may have to speak for you if you're in pain or you can't express things. So be a self-advocate as often as you can, but don't feel like you have to do everything alone.
Right.
That's not what it's about. Colin, anything there?
Well, I just on that point, make sure the person who's supporting you knows you. So if it's like if it's like an emergency, if something's going on where you're in the emergency room, they're able to say, hey, Colin has this going on, you know, has this thing, and this thing going on, and this is going on. What do we do about it? You know, just so they aren't confused about you, and you aren't having to struggle with something that you could explain, but you're relying on somebody else to explain. Make sure they know you.
Good. Just be on the same page.
Yeah.
Great. Okay, so let's just go over again. Next slide. That's my dog. So ask doctors and nurses to speak directly to you. Ask questions about what the doctor or nurse tells you. Ask them to use words that you understand. Find out how you can see the same doctor as often as possible. Tell them you want to be healthy, that you have a good life and you want to enjoy it. And be a self-advocate, but remember that it's okay that if there's a time when you can't be, to get help. That's okay. That happens to everybody, and that's good. It's good to have a support system. Let's see, next slide. Are there any other things that you want to mention, Colin, or is there anything you want to say, Tyler, about your healthcare? Any ideas you have?
Well, let's see. Now I'm working on okay, like some athlete, like some Special Olympics athletes don't have insurance. Well, my plan is now I'm the global health manager, and I'm writing a letter to my senators in Washington, D.C., and a letter to Governor Kelly. Well, what is my plan to get a athlete a Medicare and Medicare and Medicaid? How the athlete to go to visit the doctors, like for checkup, for go see the eye doctor. What they need to, my plan is to work on insurance.
Right.
And I need, if I go see Governor Kelly at the Topeka, maybe I can ask her and say, Miss Governor, can we get some insurance card for each athlete? Don't have it. And say, can we work on a new policy for state of Kansas? Can we change that a little bit?
You know, that's an important point, Tyler, because if you noticed in the video, one of the activities that self-advocates do is they vote. And you're talking about even going beyond to talk to legislators. So I guess I guess another tip would be to talk to your legislators about Medicaid expansion, because that would help a lot of people get insurance and get coverage so they can be as healthy as they can. I think that's a really important point to bring up. Thank you. Thank you. How are we doing on time, Jesse?
Right at 30 minutes.
Okay, well, I think we can wrap it up here, but I thank my co-presenters, Colin and Kim and Tyler. I appreciate your weighing in. And Jesse, we appreciate the opportunity to share this information. Thank you.
Thank you so much for hosting for us and doing this for us. It was such a pleasure.
We wish you all good health, and we admire all you athletes who get out there and get physical activity. Good role models. Thank you.
Thank you.
Right.
Thank you, guys.
Bye, everybody.
Bye. Bye.
Y'all have a good one.
Nice to meet you, Tyler.
Nice to meet you guys.
Bye-bye.
Bye-bye.